few moments. I want to talk first, though, about coronavirus tonight. And the number of fatalities compared with Monday's figures show a rise of 265. The UK has now recorded 367 more coronavirus deaths in the latest 24-hour period. That's the highest figure since the 27th of May. Dr. John Campbell is an independent health analyst, former senior lecturer in nursing studies at the University of Cumbria. Thank you for coming on the programme tonight, Doctor. I wonder what you make of some of these figures. They're going in the wrong direction.
Well, they are, aren't they? I mean, the number of new cases today officially was nearly 23,000. And if you actually look at the COVID symptom tracker app, the Tim Spector app, there was 43,936 new reported symptomatic cases in the last 24 hours. And that's always somewhat of an underestimate because it only picks up people that are symptomatic. So we can definitely see that the numbers of cases are going up. But I think we need to compare this to the number back in March at the peak of the first wave, when cases were increasing by 100,000 to maybe even up to 200,000 per day. So we're not as bad as we were because the testing, of course, is so much better now. I mean, today we've done over 250,000 tests. There's nearly 30 million tests have been done altogether now in the UK. So it looks bad. But actually, I think to jump to the bottom line here, Tom, is I think the government strategy is working. And let me tell you why. Let me tell you what I'm thinking here. So we've got all these new cases, and it looks really bad. But if we look at the past week, from the 20th to the 27th of October, the cases have only gone up by 7.3% on last week's cases. And then if we go back another week to the 9th to the 16th of October, then cases increased by 14%. And if we go back to September, cases were doubling every 7 to 8 days, so basically 90 to 100% increase in cases. So actually, if we look at the level of increase in cases, that's actually going down. So of course, the total number goes up all the time, of course, yes, but the rate of increase is decreasing. So what I would hope at the moment, for the past few weeks, the increases have been halving every week. So this strategy does appear to be working because first it's going to reduce the rate of increase before it reduces the actual number.
Yeah.
So next week I'd hope for 3.5% increase, the week after 1.75%, and hopefully in a month or so, no new cases, no increase in cases at all. There'll still be lots of new cases, but if there's no new cases or no increase in cases, that means the R value is going to be less than 1, and that means the numbers start to go down.
Which clearly also, at the rate of infection, helps with hospitals in managing this because they're not going to be overwhelmed. They've got the capacity in there. And in these figures released by the ONS, really interesting about, unfortunately, where some of these deaths are occurring. It says the numbers of deaths in hospitals remained below the 5-year average in week 42. The number of deaths in private homes and care homes were above the 5-year average. So unfortunately, it seems like people are dying at home.
There is an increased tendency there, but if we look at the hospitalisations, they were up quite significantly. So 1,152 new hospitalisations, now over 9,000 people are hospitalised. But again, if we can compare that to the peak, it was nearly 20,000. So there is some residual capacity there. But whenever someone's very, very ill, a decision has to be made whether to hospitalise them or not. Now, if possible, I will choose to die at home. I think most people would choose to die at home and die in the facility that they're used to. So I don't think there's any indication where there was a situation in Sweden for a while and in North Italy where cases just weren't, hospital places just weren't available for the cases. I don't think we're in that kind of situation now. So we were talking about deaths before, and of course the deaths have increased. I mean, 367 deaths in a 24-hour period. It does look pretty bad. I mean, I think that was the new number of deaths, wasn't it?
Yes.
Large number of deaths, but those deaths are a result of infections that occurred pretty well a month ago. So if you like, we're paying the bill now in deaths for the infections that occurred a month ago. And because the rate of increase is going down now, we should be reaching the peak deaths in about 4 weeks' time from now.
It's really interesting. Doctor, just before I let you go, because we'll talk about this in after the news at 11, the comments from Lord Jonathan Sumption, former Supreme Court Justice, who's given this lecture tonight. And it is worth seeing it in full. I've posted a link to it because it is an absolute demolition job on the government's approach to lawmaking throughout all of this. But he basically accuses the government of propaganda and stoking fear in order to justify the COVID lockdowns. I wonder what you make of that.
I think we've got to be so careful not to politicise this. We've seen this with disastrous consequences in other countries that could be named across the Atlantic. I really think we have to be very careful not to do that. And I think the argument I've made here about the decrease in the increase in cases is a pretty strong argument. So I think the current strategy is working, but it takes time. There's always this delay. We have to be patient and keep going for another month, and then we'll see the cases levelling off, and then I think we'll see it go down. The alternative is having hospitalisations get to the point where we basically can't cope. You know, we don't want that deja vu feeling from last sort of March, April.
Not.
So,
and we don't want to have the response that the government instituted then, which was to put in that lockdown. Doctor, great to talk to you. Yeah. Fascinating. Thank you very much.
Okay, thanks, Tom.
So much, Doctor, for coming on.
Health analyst, former senior.
We'll definitely be back in touch soon. So yeah, keep in touch, Doctor.
Yeah, ring anytime. That's fine.
10:42.
Okay,
Thank
thanks.
you so much.
Thanks. Bye.